Welcome to our continuing series of virtual voices focusing on the United Nations Sustainable Development Goals. Thank you for your letters and comments. We appreciate receiving them. It is a great pleasure to have with us today Dr. William D. Hardy Jr., Doctor of Veterinary Medicine, who is the President and Director of the National Veterinary Laboratory Incorporated, which he established in 1972. Dr. Hardy graduated from the University of Pennsylvania School of Veterinary Medicine and joined the staff of the Memorial Sloan-Kettering Cancer Center in New York, where he studied for cancer viruses for 24 years. He was then appointed professor of medicine at the Albert Einstein School of Medicine and was the director of the Center for Infectious Diseases at the Bronx Lebanon Hospital. He was a consultant in the Infectious Disease Service Department at the Memorial Sloan-Kettering Center and also adjunct professor of oncology at the University of Pennsylvania School of Veterinary Medicine. Dr. Hardy has been studying feline and human retroviruses, feline leukemia, sarcoma, and immunodeficiency viruses, and developed the first test for feline leukemia. He discovered that the feline leukemia virus is spread contagiously among cats, which was the first example that retroviruses could be transmitted contagiously in any animal. Dr. Hardy authored 255 scientific articles and presently is focused on zoonotic diseases, pandemics, climate change, and worldwide resource utilization. Dr. Hardy, over to you.
Thank you, Dr. Dovek. I'm very happy to be able to present our work today. We're going to talk about the zoonoses, animal agents that get into people, diseases that are transmissible to people from animals, and pandemics, which we're in right now, and the One Health approach, which I think is an important approach to help us control some of these very deadly diseases. Infectious disease can be caused by several agents. The virus, such as SARS-CoV-2, causing that disease, bacteria such as the TB bacteria that has been around for eons, fungi, prions, which is the mad cow protein that can cause some neurologic diseases in animals and people, parasites such as malaria, still present in many parts of the world, and even the arthropods, the fleas, the ticks, and the lice can cause skin disease, dermatitis, and of course, they can transmit the agents above to human beings from animals. Now, the level of occurrence of diseases is important. You may have read or hear on the news of a sporadic disease. That's a disease that occurs infrequently or irregularly, sporadically. A cluster disease is a group of the same disease occurring in a place and time that is greater than the number of those that disease to be expected. An endemic is a constant occurrence of a disease, usually in a geographically defined area. Hyperendemic is the same thing as the endemic, but it occurs at a higher level. And we'll talk about some of that when I get into the diseases. An outbreak is an endemic disease occurrence in a limited geographic area. Sometimes outbreaks occur in neighborhoods or in kennels or in schools, not a very large area, but a geographically defined area of a disease. Epidemic is a sudden increase of a disease of cases above the normal for that population. An endemic can occur in, let's say, the state of New York or the state of California. a more defined area. And a pandemic is what we're in right now for the last year and a half, just about, is an epidemic that has spread to several countries or continents, or even worldwide, as is the case of COVID-19. Zoonotic disease. The definition of a zoonotic disease is very simple. It's an infectious disease, a virus, a bacteria, whatever it be, of animals that can be naturally transmitted into humans, not experimentally, but occurs in nature. There are over 200 types of zoonotic diseases today. 60% of all human infectious diseases originate and have originated from animals. And 75% of all emerging new infectious disease to come will come from animals. So this is why there's a good interface between the One Health group, which consists of veterinarians, physicians, PhDs, dentists, nurses, engineers, statisticians that have to work together to approach our health condition in the world and locally as well. But we need to understand where zoonotic disease started. We really don't know where viruses and bacteria, how they originated, but they probably came from cells as the evolution of life on Earth occurred. The early human beings that evolved into the Homo sapien species, 12,000 years ago in the Neolithic revolution, the hunter-gatherer societies, those that just went out every day and hunted animals, ate them, and moved on, abandoned that lifestyle. It was too hard. They went to form villages and they began to domesticate animals and began agriculture, a much easier settled life. Here's a village in Africa that I photographed in Kenya in the Serengeti plain. Our early villages were like this and still are like this in many parts of Africa. They're in a circle. They have their living quarters and they have their animals that they're domesticated living at night within there. So they're protected from the wild animals. During the day, they take the herds out, whether the goats or cattle, to allow them to graze on the food outside and then return to safety at night. They're used as a food source. Now, this brought humans and animals closer together because they lived together in near villages. And we call these agents that occurred in that time, quite a number of thousand years ago, heirloom zoonotic pathogens, such as mumps, smallpox virus, and Bartonella. And many of these heirloom pathogens still exist today. They look like human-only diseases, but they originated way back from animals. Now, how are zoonotic diseases transmitted today? They're either indirectly or directly. And here is the direct contact of body fluids from an infected animal, saliva or blood or urine or mucus or feces. Now, here are the places that they're transmitted directly in wet markets, as the present pandemic, the COVID-19, the coronavirus originated in markets selling wild animals for food in China. Hunting and bushmeat, when they hunted wild animals such as chimpanzees, HIV arose from that, and I'll talk about that in a few slides from now. Foodborne transmission directly is Salmonella and E. coli. We hear about food poisoning very often. Every day we hear about food poisoning and recall of food. Waterborne can also, animals can urinate in streams, leptospirosis from rodents into streams. People camping will take a ladle full of water and imbibe the leptospirochete. We as veterinarians have great safe vaccines for dogs that prevent leptospirosis in dogs and transmission to owners of dogs. Pets, toxoplasma, rabies, ringworm, and Bartonella, the cat scratch bacteria, which we've worked on for the last 20 years, are zoonotically transmitted from pets to their owners. Farming and animal husbandry, Salmonella and E. coli, especially in the factory farms that crowd the animals together in very unsanitary and unpleasing conditions. And the wild animal and pet attacks that occur in our neighborhoods and in the environments can certainly transmit rabies from skunks, from bats, from dogs, cats in whatever environment they're in. Now, the indirect contact is by vector-borne or deforestation or climate warming. Vector-borne malaria is transmitted by a mosquito in Africa. It is still a widespread disease that kills many people. Lyme disease in our neighborhoods, our backyards, in endemic areas such as the Massachusetts and the coast of Massachusetts is transmitted by a tick. The plague over centuries has been transmitted by a flea from the rat that co-inhabits the area around human dwellings. Now, the bat is a kind of a repulsive animal, but some are actually look like dogs. The fruit bat is a very interesting and rather beautiful animal. But these animals are reservoirs for many deadly viruses. Many of the coronaviruses, rabies viruses, you name it. But what's interesting, their unique immune system protects them from diseases, from these deadly viruses that get into other animals and humans and can be deadly. Bats rarely die of these horrendous virus infections. Many societies eat bats as a delicacy. They're sold in wet markets, and this is the basic source of the COVID-19. Veterinarians, we have very effective rabies vaccines for dogs and cats, even horses and cattle, pet and farm animals, and even human beings now can receive rabies vaccines when they go to endemic areas like Africa, India. A traveler, the tourist should be a rabies vaccine to protect them against the possibility of getting bitten by a rabid animal in these third world countries. Now, you probably all well know the story of HIV. HIV originated from bushmeat hunting in West Africa. The primates there, the chimpanzees and the monkeys, had a retrovirus, the kind that we worked with at Sloan-Kettering for many years, that were occurring in the primates, but it didn't cause any disease in these lower primates. When they were hunted, either the women or the men would prepare the meat for food, and they would then get the blood of the primate on their skin, either through cuts or microabrasions or in their eye, whatever it may be. They were transmitted, the virus was transmitted from the primates to humans, and then the virus in humans mutated into what is now called the HIV virus, which has then been a pandemic for many years. I'd like to call your attention to two wonderful books. This one, I'm sure you have seen as a bestseller back in 2012, Spillover. And this was the book about animal infections and the next human pandemic. Well, after this book, there were about 6 pandemics that occurred after this book. He was absolutely correct, David Carman. And it said that there will be human pandemics. And I would say, unfortunately, today, there will be more zoonotic human pandemics to come. Here's one of the reasons why zoonotic pandemics occur near human habitats. This book is called Nature Wars by Jim Sturba. Jim was a diving buddy, a scuba diving buddy of mine for many years, a very excellent New York Times reporter who wrote this book again in 2012. And it warned about the animals. We're encroaching out of the cities into suburbs, into the animal territory. They're co-living with us in our backyards, and they can transmit things such as rabies, Lyme disease, and other arthropod or tick-borne diseases. Looking out our backyard one day, we had a herd of deer, but I only was able to photograph 2 of them. They can transmit Lyme disease from their infection very close to our households. So can stray cats. Many people feed feral stray cats. Not a good situation. They can transmit rabies, Bartonella, and other diseases to people. Multiple cat owners who collect cats, either as strays or as purebreds, can also have an ability to live with animals that can transmit diseases in a household. Stray dogs, rabies, especially in India. Wild pigs can transmit diseases by food to human beings when they're hunted, and rats have been known for centuries to cause deadly diseases, plagues, and other diseases. Rats living in our subways, our sewers, in our neighborhood. Wood rats live in our suburban neighborhoods as well. We attended the first One Health Congress in Melbourne, Australia in 2011. And this again is the conglomeration of veterinarians, physicians, PhDs, engineers, everybody who wants to, epidemiologists, work on animal and human diseases. And there I met with Tracy McNamara, who is a veterinarian, who worked very close to where we all are today. She worked at the Bronx Zoo as a pathologist, and she began to notice her exotic birds getting encephalitis and neurological diseases and dying. And by reading the newspapers locally in New York, she realized that the hospitals were seeing in human patients encephalitis and problems exactly as she saw in these wild birds in the zoo. She then alerted the CDC and other agencies that something was going on. She had to push hard to get them to take her seriously, but sure enough, she's the one that first alerted everyone to the West Nile virus coming out of Egypt and that area into the Americas, being transmitted by a mosquito right here in New York City. And it comes up every summer, the occurrences of West Nile disease transmitted by mosquitoes in our area and everywhere else in the country. So zoonoses, animal disease, animal agents that come from animals into human beings. And I'll give you a veterinary view since I am a veterinarian. I've worked on these diseases for years. While we're at Sloan-Kettering Cancer Center for 24 years, the feline leukemia virus was discovered in Scotland by Bill Jarrett. That virus was shown to be in the blood by electron microscopy. We developed a test quickly that would show on a simple blood smear whether the virus was in any cat, healthy or cats that had leukemia. And you can see this fluorescent green color. That means that this blood of a cat is infected with the feline leukemia virus. Many would die within a few years because of that infection. Here's a negative test of a cat that does not have the feline leukemia virus. These are all the white blood cells that are not stained by the viral proteins. We then found that by taking this test in the field, that we could show that it was spread contagiously cat to cat, and we can control and prevent more epidemics occurring by testing and isolating or quarantine cats, exactly what was done and hoped to have been done correctly when the COVID-19 epidemic began in the world. Now, again, a veterinarian's role with Bartonella. Now, Bartonella, you may have heard of cat scratch disease, cat scratch fever, which is a song, but cat scratch disease is something that was really first shown in about the early 70s and 80s, that the bacteria was there, but no one thought much about it, except several veterinarians. And we now know that the cat, especially the pet cat, and humans share this bacteria, unfortunately, in a zoonotic state. Then we found out over the years, we meaning all veterinarians and researchers, not us, that the pet cat was able to infect people in families. These are my grandkids 20 years ago, that when they had kittens or cats, they could be infected by a scratch or a bite of a cat, the transmission of the Bartonella bacteria to them. And then as the years went by, we then had put this mosaic. All these animals, whether they're wild, large cats, farm animals, camels, guinea pigs, squirrels, canines, even marine animals, porpoises, beluga whales, sea turtles, the lovely little otters, even deer and elk, all carry their own Bartonella. And some of these Bartonella can get into humans occasionally, but the one that's the major one is coming from the pet cat, which is called Bartonella henselae. The cycle is very simple. The pet cat carries the bacteria. The flea bites the pet cat, picks up the bacteria in their gut, jumps on a cat that is not infected, bites that cat, transmits the infection, and the cycle is cat, flea, cat, flea. Occasionally, the cat in a family situation will jump out, play with a kitten would play with an owner or a child in the household, and infect that person with a simple scratch or bite. And that infection can go on for several months before any disease signs occur in the human being. And that's why there can be quite a bit of damage before they seek help from a physician. Unfortunately, many physicians don't know much about Bartonella in humans. And I think this is where the One Health approach will help by educating not only veterinarians, but physicians to look for these kind of diseases, which are kind of nondescript, unfortunately. Now, Bartonella in cats is endemic along the seacoasts of the United States. In fact, it's hyper-endemic along the coastal states. 49% of healthy pet cats in the Gulf Coast states, Texas, are infected with this zoonotic bacteria, as well as the Carolinas, 35%. But as you get up north, it's less. And when you get into the drier or colder states where fleas are not welcome and don't live very well there, there's much less Bartonella in the cats and much less zoonotic disease. And certainly the coast of California and the Pacific Northwest is very habitable for fleas. Now here's the shopping list, unfortunately, of Bartonella diseases obtained from pet cats zoonotically that can occur in human beings. They can affect the brain, cause inflammation, much like COVID does, cause general inflammation. And this is what Bartonella does. It causes general inflammation. It can cause cognitive effects, what they call the brain fog. They can be depressed. They can have dysfunction using words and numbers, all because of inflammation by Bartonella in the brain. Even worse, they can have large granulomas of the brain of a person and cause defects, seizures, a motor neuron defect, which can affect gait or use of arms. Enlarged lymph nodes, vegetative lesions on the heart valves of people can occur where the heart valve has to be replaced. You can't treat this with just the antibiotic because there's all scar tissue. They have to replace that heart valve in a person because of infection from their cats. Arthritis, inflammation of the joints occurs in many people with Bartonella. Inflammation and granulomas of the spleen and the liver can be life-threatening. And inflammation and granulomas of the retina. The retina is obviously very important. It's the film in the eye that allows for sight. And a number of people, if they're not diagnosed quick enough, if they have this granulomatous inflammation in the retina, can lose partial sight or the entire sight in one eye. That can be tragic. So it's a disease not to be slighted. It can be a zoonotic disease from our pet cats, which are welcome pets in probably more than half of all households in this country, that there is a risk unknown to many of the cat owners. Now, zoonotic pandemics, they've been around since almost, in fact, probably from the turn of the evolution from subhuman primates into human beings. Plague, well back in the early ages of evolution, has decimated Europe, killed almost half of the population over the ages with the bubonic and pneumonic plagues, which was a bacterial disease transmitted from rats living in unhealthy, filthy environments of cities in Europe, because they didn't know at that time about the germ theory. They would throw the garbage out the window. Rats would flourish. The fleas on the rats would flourish. They would jump onto humans, infect humans with the bacteria. Only after the germ theory was scientifically rationalized and proven did they start to clean up the cities of Europe and the rest of the world and reduce the outbreaks of plague. HIV AIDS occurred in West Africa in the late 70s, early 80s. from bushmeat hunting and eating of subhuman primates. And as we know, unfortunately, the SARS-CoV-2 virus, a coronavirus, which is carried in many animals, have coronaviruses, including human cold virus. The cats have it, bats have it, farm animals have coronaviruses, but only some of the coronaviruses are changed to become zoonotic. A little bit about the pandemics, because unfortunately, pandemics have been with us, the plagues as early as 430 to 426 BC. Influenza first described in 412 BC. The first major endemic in the literature was 1510, and the Spanish flu was 1918, which decimated huge numbers, millions and millions of people died in 1918 pandemic. Measles began in the 17th century, the smallpox in the 17th century, and in the 20th century, it killed between 300 and 500 million people before this virus was eliminated on Earth. TB, 25% of all people today are infected with TB chronically. In the 19th century, in the 1800s, 25% of all adults in Europe were killed because of TB infection. And yellow fever still persists to this day in Africa and South America. And you need yellow fever shots to go to certain countries such as Kenya, Botswana, and even now, unfortunately, South Africa. There are some of these zoonotic ongoing pandemics. Malaria still kills a lot of people in Africa. Rabies, between 30 and 50,000 deaths a year. Stray dogs biting people in many parts of the third world, especially India. HIV is still with us, but we have a very effective treatment regime which can keep people alive as a manageable disease. We don't yet have a good, effective vaccine for HIV, but maybe this new technology of the mRNA will allow a vaccine to be produced properly. And that's one of the benefits that might come from the COVID-19 pandemic. And as you know, the COVID-19 pandemic is still present. Rabies, ongoing epidemic in the third world because of uncontrolled, unvaccinated stray dogs. Again, the deaths in the world are quite high. And we have, as veterinarians, effective pet animal, cats and dogs, and farm animal vaccines. And the physicians have very effective human rabies vaccines. So we can prevent, at least the prosperous countries can prevent rabies a lot better than, unfortunately, the third world countries. Now, COVID-19, the pandemic that we're all so focused on and that has really changed our life. It originated in Wuhan, and I always thought this city would be a little backwater place in China, filthy with bad streets, with shack-type houses. Well, this is Wuhan. It's a beautiful city, and we toured China several years ago, and there are dozens and dozens of these cities like this, beautiful cities all along China that are really a beautiful area to live for humans, but they exist with wet markets because the Chinese love to eat exotic food. It's a status symbol in a way when they have guests over. And here is the wet market where roughly the virus originated in this general facility from bats. But all the dead animals are hung up to be purchased. But here's the menu: donkey, dogs, and cats, and pet cats, goats, cattle, pheasants, ostrich, camels, deer, salamanders, snake, other carnivores, dogs, and rabbits, and even porcupines. There's an area of crawling with insects, which are used again as food for those people who would like the exotic diet. SARS-CoV-2 originated from this animal. The horseshoe bat has coronavirus, which is almost identical to the present virus. It got from the bat to another species. We're not sure which it was. a pangolin or a snake or whatever it may be. It then mutated and got into human beings as this virus, which causes a severe respiratory syndrome. From there, it's been spread all over the world. And this slide just shows you that we're not the only animal that is susceptible to the virus that causes COVID-19. Mink especially, and pet cats and ferrets are highly susceptible to infection from us. The human being transmits it through the droplets to these animals in the household or on the mink farms. Millions of mink have been culled because of the infection, and a few minks have been able to transmit the COVID virus back to human beings. And this is a very worrisome situation, since we feel that the virus in the mink can mutate in a more dangerous way, possibly, and cause a more virulent and more easily spread virus, a little different than the original isolate. And pet cats that were infected experimentally with the original virus, housed next to another group of cats in cages, no contact, by aerosol transmission, the infected cats experimentally were able to transmit it through the air, just like we do it to human beings, to pet cats. So that is really a problem. And there have been dozens and dozens of examples of pet cats exposed to sick individuals, their owners, being infected. Most pet cats don't show any disease at all. If anything, a slight respiratory problem. They don't die of the disease, but they can, we think, possibly transmit it back to humans, although there's no example of that as of yet. So yes, pet cats are infectable and they shed the virus. Dogs are infected, but they don't seem to shed it and transmit it to other dogs. Ferrets definitely are, and they shed it easily, as well as mink, and hamsters are infectable. So these are the animals that would be found in households as pets. Now, you've heard of herd immunity, and we take pride in that as a veterinarian and the veterinary profession. Humans don't live in herds, but animals do. And it's a veterinary term first coined probably by Eichhorn and Potter, veterinarians, in 1916. Herd immunity occurs when a sufficient percent of a population becomes immune to infection, either through vaccination or exposure. That's very important. If you've got most of the exposed or susceptible individuals immune, then it's a block. It achieves herd immunity, disrupts the chain, and stops or slows the virus or the agent spread from the infected animal to other people. Since they're immune, they cannot be infected. At least if they are infected, they will not die. Now, here's a table I want to show you. It only shows you the degree of the herd immunity that we need to prevent people from getting these diseases and maybe dying from them. Influenza, every year we get a flu shot. You only need 30 to 44% of people with the vaccine to at least stop major pandemics occurring. And I think we're reaching that. Even though the vaccines are not very good, they're good enough to prevent major pandemics like we have seen in the 1918 one. The Ebola, a horrible disease in Africa spread by body fluids, frightening about 10 or 15 years ago. It's still frightening because it still occurs in Africa. You need only 60% herd immunity to stop that disease from occurring, even protect the individuals in those remote villages. The COVID-19 droplet transmission, the virologists calculate we need, based on the ability of the virus to replicate, 60 to 70% of people to be immunized, not infected. We want them immunized, not like the Swedish experiment where they just wanted everybody to be naturally infected and let those that die. That to me was terrible, and it didn't work. But we need up to 75% protection by vaccination. Polio up to 86%. Now, polio has been reduced worldwide through a very strong UN program of vaccinating people. diphtheria, rubella, and up here, measles. It's one of the most infectious diseases on earth. You need almost 95% of all people to be vaccinated against measles to prevent it. And as you probably have heard, because of religious exemptions or by anti-vaxxers, where people in certain outbreaks, enclaves, small areas, don't have their children immunized, there are measles outbreaks that occur. Our vaccines are wonderful. It's a miracle that how quickly this was done. 2 of the 3 vaccines are mRNA. That is, they have the mRNA from the virus safely put into a globular fat in the vaccine. It then instructs, once it's vaccinated to people, the cells that take up the mRNA to produce the viral protein on those cells. There's no virus introduced into the person, and the mRNA can not go backwards and change the DNA, like unfortunately, like some misinformation on the web says. It cannot alter the genes, and there's no microchip in the vaccines that will trace people around the world. Today in the United States, as of 2 days ago, Johns Hopkins, a wonderful data source of tracking, 32,900,000 people have been fully vaccinated, but we have lost, cases, 32 million cases. We've lost over 500,000 people through the disease. We now have 123 fully vaccinated people in the US, but we have 332 million population. So that means if you just divide that at a fraction, we have about 35% of people with herd immunity. Well, what does the virologist tell us? It tells us that we need 60 to 75%. So we're about halfway there. That's a wonderful goal in a few months. And as long as we can keep people getting vaccinated, we can do this. However, think about this. 7 billion people in the world. We need to vaccinate all these people, otherwise there'll be outbreaks again coming back with maybe variants that are much more dangerous. So we've got to share our vaccines with the world. There have been 223 breakthroughs, deaths after vaccination, according to the CDC. They're not sure that all these people who died after being vaccinated actually died of the disease. They're trying to figure that out. But even if all of them did, there were 115 million vaccinated as of May 10th. And this would give a risk ratio of infinitesimal. You're much more likely to get to die from getting in your car today, or from lightning, or from just touching an outlet that may be hot with electricity, than certainly a vaccinated person getting infected and dying from COVID. Okay, we're almost there to the end. So Dr. Durbeck can relax and not have to get the hook out. So what can we do to prevent the pandemics? The One Health approach, everybody working together in every profession, whether it's science or engineering or even the internet. We must support Science Matters. And we marched in Princeton when the Science Matter parade went on about a year or so ago. We got to support infectious disease research with our dollars, with our political support. We must support the World Health Organization, the UN agencies, and the CDC, again, with finances and political support. We've got to reconstitute the director of the Global Health, Security, and Biodefense, which was a White House advisory panel on zoonotic diseases and pandemic established in the Obama administration, but emasculated about a year or so before COVID-19 hit the world. We must reestablish the White House advisory panel on invasive species. It was only removed because of anti-science fear, political thought. This budget for this panel was $1 million a year. And if it was certainly not because of budgetary concerns with our multi-trillion-dollar budget in the United States. We've got to urge and put pressure on China to be more open and transparent about diseases that occur there and not cover them up for even a week or two before they announce it to the world. 3 minutes. Smallpox has been eliminated from Earth. amazing vaccine program for the last 20 years. It has worked. There's not a case of natural virus infection. And I think all the freezer variola vaccines have been destroyed, so it cannot be used as a defense or offensive weapon. Terrible disease, as you see in this individual. Rinderpest, a virus of ungulates, cattle, buffalo, giraffe, rhinoceros. It's a type of virus that is similar to measles and canine distemper. In 2010, the United Nations Food and Agriculture Organization announced that it was totally eradicated from Earth. And here you see one of the emaciated cattle in Africa. They rely on their cattle stock and buffalo for meat and for subsistence. And when they were all dying of rinderpest, it was a major catastrophe for the human race. Okay, I hope I've kept your attention, as shown by these ostriches. They've not stuck their head in the sand. But I'd like to show you how we do some zoonotic African field studies. As you can see, we were studying these male lions who looked at us for an hour or two and said, this is not worth anything. So they decided to take a nap. And as they did that, we had our cocktails. And I certainly want to thank Dr. Durbach for her invitation to present this work on zoonotic diseases to your organization, the World Information Transfer Virtual Voices. And I want to thank Dr. Richard Reed from the Animal Clinic of Bayonne for suggesting that I give this talk to Dr. Durbach a month or two ago. So I would like to thank you again and be happy to answer any questions that anyone would have.
Well, first, Dr. Hardy, it was just an illuminating and brilliant presentation. I couldn't keep my eyes off the screen. And we have a lot of questions, so I will forward it to Ariel because she's been collecting the questions. I've been too busy listening to you. Ariel, over to you.
Thank you, Dr. Durbach, and thank you, Dr. Hardy, for such a brilliant presentation. We have many, many questions for you. The first is, do you support the division of regions into zones during a pandemic? Does this affect the number of cases? And have you noticed a positive trend after zoning?
Yes and yes. I support zoning because the human race cannot all take instructions correctly. And yes, there are different amounts of disease in certain parts of the country. So they don't need the lockdowns that other parts do. So that being said, I support that done based on science, not just a political whim. But there have been parts of the country that have opened up or relaxed their restrictions much too early, as we saw with the motorcycle gang in one of the Dakotas. Everybody came in and had their rally, and there were hundreds of people infected in that rally and many deaths. So you've got to understand what the zones are, what has to be done, and it does matter. The science from the scientists should be adhered to.
Thank you. The next question is, do you think that we will need to wait for new mutations for COVID-19? And to elaborate a little more on how COVID-19 has affected animals.
All right, the mutations are very worrisome because RNA, there are two groups of viruses, those that are made of RNA and those that are made of DNA. The DNA viruses do not mutate very quickly, but the RNA viruses, such as the feline leukemia virus, the AIDS virus, the COVID, the coronaviruses, tend to mutate quickly. And that's bad because a simple mutation, every replication has a chance for a mutation of that virus. And many of them do mutate and is of no significance, but occasionally they mutate for the worse. They're more infectious or they're more disease producing. So we hope, and so far the data shows that the present vaccines are pretty protective against not only the present original virus, but many of the strains of mutant viruses coming from South Africa, from England, for the UK and other places. So I think it's important that our vaccines will be protective against that. My worry with animals, since you saw all the animals that can be infected, their genes and their ability to replicate the virus even quicker than we can, such as the mink and the ferret, may allow for more deadly and more infectious viruses to occur. And then if those viruses get back into the human beings, we could then need a whole new set of vaccines. That's the worry we have with animals. So we've got to make sure, and there have been millions upon millions of mink farms decimated, and the mink have been euthanized because of the fear of that virus spreading. Some of the mink farms had almost 80% of the minks infected. And a lot of people don't like mink farms anyway because of, you know, the inhumane treatment of animals for fur. But that is a worry that has been handled, at least in a scientific matter, as a public health reason.
The next question goes off of that actually, which is there a vaccination for pets to protect the pets from developing that type of mutation? And can hygiene and cleanliness further prevent that infection? Or is that not possible?
Well, there's no vaccine yet, but there are a bunch of drug companies, veterinary drug companies, that are trying to make a vaccine for pet animals or for any animal that may or may not be of any use. The problem can be solved very quickly. If anybody in a household unvaccinated feels like they're sick, they have a respiratory problem, they should definitely stay away from their pet cats and dogs in those households. Not do anything around any other animal until they're either diagnosed with or without COVID. And if they survive it, and when they're then healthy, then they can go back to handling their pets. But it's very hard to know when you're actually early infection before any signs show. So it's going to be a problem, but I don't think there's going to be a vaccine for all the animals for COVID. The one thing would be the best way is to get it out of the human population, so we don't have the problem of transmitting it to back to animals. But an interesting thing to think about, there is a disease in cats called feline infectious peritonitis. It's caused by a coronavirus. And a friend of mine who's a graduate student, Oswald Jarrett, a veterinarian in Glasgow, his student worked with this virus, and it's a deadly virus. The prototype virus, it lives in probably 80% of all cats, in the gut of cats. Only some of those viruses mutate within the cat to cause the deadly virus, which then kills that cat. Now, they have found ways of interfering with the viral replication of that coronavirus in the gut before it becomes dangerous. And they've cured cats of that infection. And they've even cured cats of the deadly disease, FIP, once it's happened. To me, that is the most hopeful thing. If we can develop a treatment to get rid of the virus in people or animals that have the infection, even not worrying about vaccine, but treating the animal or the person with a chemical much like is used in HIV AIDS virus treatment, that would be a major milestone ahead. And there are people working on that. And there are veterinarians who showed the way with some very important papers on how to prevent that coronavirus from becoming lethal.
I have a cat myself. And so to hear something like that does bring so much hope, because that's so scary. And so the fact that there's already been a treatment that has come out for that type of disease, it does bring a lot of hope for the future of COVID. The last question that I have for you is, what is the percentage that a pet will catch an infection from its owners and then pass it back?
Well, the percentage of pets catching it from the owners is minuscule. It's probably in the world publications, either in newspapers, magazines, or in scientific journals, probably no more than 150 cats that I'm aware of that have been infected from their disease owner. There's no example of the reverse zoonosis of it going from the cat back to people who are not infected. So none of that has occurred from cats, but it has occurred from minks. The attendants in the mink farms, there were so many minks infected. Some of the non-infected people that attended to the minks were then infected from the minks. They could show that by the fact that they can sequence the actual genes of the virus to show it came from the mink into the person. It wasn't just they were close by it and it was a coincidence. They proved it genetically with the genome of the virus coming out of the mink back into people.
I have a bunch of questions here. Dr. Hardy, if you do not mind, the first is an interesting question. This is from one of the graduate students. The Netherlands has completely eliminated stray animals. Do you think that this is something that the rest of the world should consider?
I definitely think it should be considered, but if you go to India or some of the villages there, it's almost impossible because cattle are sacred. Dogs are basically the same way. They feed the dogs, the stray dogs on the street, the stray cats. There's a bond between Indians and in India and animals, and I don't know how that'll ever happen. The Scandinavian countries are much more regimented in everything they do, but I don't think it's possible in many of the third world countries that just don't have the economics for that. I mean, all you need to do is scoop up all the stray animals, vaccinate them, and then if you want, put them back in the streets, but that would be silly. It's theoretically possible, but I don't think it's really practical at all.
Well, you're right from the perspective that the human population has been added 1 billion of people to this planet since 1960. That's why we're over 7 billion. But
Right.
Here's another question from a graduate student. If humanity stops experimenting on animals, could this improve the statistics of infectious diseases and pandemics?
No, I think it would actually be harmful for the control of diseases. Unfortunately, some animals, the only way to prove a therapy works or there's an agent that is causing disease is by inoculating animals. We try to do that in as few animals as possible and as humanely as possible. But I don't think that it's totally impossible to stop some virologic or bacterial experimentation on animals as long as it's done under the strictest control and using the fewest animals possible.
Another question from a graduate student. Please tell us, is it possible for students to join the One Health activities on a volunteer basis?
Oh, that's a very good question. Well, there's a great movement in the One Health. And if whoever asked that question would email me, wdhardyjr@aol.com, I would be happy to look into that. I don't know. I know there are a bunch of organizations of veterinarians, of physicians, of other scientists that are working within the One Health units. And there may be field studies or some type of work that could be utilized from volunteers. That's a very, very good question.
As another question, in your opinion, can we somehow help to completely ban animal testing?
I don't think so. I'm a veterinarian. That's the last thing I would want to see is animals used needlessly. But in certain areas, I can't think of it. Certainly, I would think using it for cosmetic work or this kind of thing, testing cosmetics for dermatitis or whatever it is not a very good use of animal. But I think in deadly diseases where there's no other choice, if you can't do it in tissue culture, you can't do it any other way, then the judicial use of the fewest animals possible to get an answer under government control, I think is still necessary, at least in the foreseeable future.
Another, I hope you do not mind, but I have so many questions. I'm trying just to give you the ones that I think that would be interesting to everybody. How can you recognize the sign of a disease in an animal?
Oh, you got to be a veterinarian.
Okay.
No, I don't mean that. It's like a pediatrician. At least a pediatrician has the mother or the father coming in and saying what the person did. But we as veterinarians have the owners coming in, if they're pet animals, saying what the pet did. Well, it has diarrhea. He's been vomiting for 10 days or whatever it is. But many farm animals are on the farm for a long time before, let's say, the farmer notices something is wrong. But you need the help of a human being to portray some of the signs when an animal is brought into a veterinarian, and that's very helpful.
And this is from another student. I'm interested in becoming a veterinarian. Are there international animal treatment protocols for the various diseases of animals?
Well, the publications of scientific research of treatments that work or don't work is basic way that all veterinarians and all physicians find out what treatments are available. And certainly the treatments that are good are picked up quickly by the drug companies, whether they be veterinary drug companies or human drug companies, and make it available to the physicians or the veterinarians. So there's not a certain organization that I know of that looks for international treatments. I think it's based on the scientific literature and those drugs that are profitable enough for veterinary and medical pharmaceutical companies to produce.
And here's another one. Is there any way that humanity can prevent the next zoonotic pandemic, and how should that be approached?
It should be approached through the One Health organization. There should be the watchdogs in America, in Europe, in India, in China, who are looking out for this. And that should be a coordinated effort. Some countries like China are very, very resistant to having people coming in and looking at what they're doing. But even though they delayed the reporting of SARS-CoV-2 for several weeks or even a month, once they isolated that virus, they gave the genome, they did the genetics very quickly and put it out for the world to know, so that quickly other countries, and America included, were able to work with that information of the virus genome and develop tests that were used. So China wasn't great early on, but they certainly helped a lot with releasing that information of the viral genome.
Okay, and this is another one. Oh dear, I cannot. Oh, it is, we have learned that vaccines can prevent from some diseases. But I was wondering, is there any limit to how much a different vaccine a person can take, and what will be the contraindications?
How many different vaccines is the question, is that right? That's always been a question. Can you give too many vaccines, or can you give them too often? In my opinion, if you look back at history, there's three major advents in human evolution that allowed us to live an average much longer than our ancestors. The lifespan of human beings used to be in the 40s. Now it's probably in the 70s in very, very developed countries, if not higher. The only three reasons that I know of is hygiene, clean water, and vaccinations. Those three things are the most important things that allow us to live longer and to be free of zoonotic diseases. So I don't know of any other than good scientific epidemiology to make sure that we're catching as early as we can any new diseases, whether they're coming from animals or coming from human beings, or coming from drug abuse, or coming from some other reason, to allow for us to live even longer, or at least to have a healthy existence for as long as we can.
Well, Dr. Hardy, I cannot thank you enough. I still have a lot of questions, but unfortunately, we have to end this webinar. And I am most grateful that you were able to be with us. And I hope that we can invite you again for some update on what is going on in the near future. And as I said, this was going to be on the web as soon as we make sure that it is in perfect condition. So have a wonderful week, and thank you for being again for us. And Ariel, thank you for helping with the questions. And
Thank
Fred,
you.
of course, thank you for setting it up so we could see Dr. Hardy more than just a blimp someplace. Have a very, very good afternoon, and do take good care of yourself.
Thank you very
And,
much. I appreciate it.
Take care.